And with that, Val, it is all you.
Thank you, Heike. I'm guessing you can hear me. Thanks for making me a panelist. Just got off the Fusion Cell call, and obviously we're talking about vaccinations, so that's probably what we're going to spend most of this call today talking about is vaccinations. First of all, just overall, the numbers for the division in the community, we now have eclipsed 1,000 cases. We're at 1,164 cases of individuals we support in the community that have contracted COVID-19. We had 10 new today, and those numbers have slowed a little bit. They were in the 20s every day. Now that they're to 10. But we just kind of expect that we're having a bit of a lull right now, and everybody fully does expect it to pick up after, next week. That gives enough time for the Thanksgiving break to really impact folks. Unfortunately, we are seeing at least one new death added a day. We're at 31 deaths now for individuals in the community that have contracted COVID-19. And as those cases go up, that number will also go up. We have 218 different providers who have been supporting or are supporting somebody with COVID-19. As a state, we're still at a very high rate. It's not as high as we were last week, but we are still at a very high rate, and we're still at a 20% positivity rate for individuals that get tested for COVID. So those numbers, while they are going down, they're still, remember, we're not good till we're below 100 per 100,000, and we're still over 466 per 100,000 cases. So we're not even good at 100, but we're at least not considered at this high, extremely high rate of transmission in our state. The CDC this week issued a new quarantine guidance. It's a little bit confusing, so I kind of want to talk a little bit about that. First of all, we've been an essential workforce this whole time. So individuals that are working to support the individuals that are getting services have been an essential workforce. So for the most part, unless, it's a household transmission or something, I know at least on the state side, and I think a lot of our providers are doing this too, we are not quarantining staff just because they're a contact of someone. The new CDC guidance is around a change in quarantine, and what it's saying is that if you have no symptoms and you test negative after day 7 or day 10, and there's some nuances in that guidance, that while you still are a risk for COVID, and if you're going out into the community with a mask, you need to be wearing a mask, but that you don't necessarily have to quarantine in your home anymore. There's a lot that, while that is guidance, that's not a law that people should be following, and I think that's what's really confusing. Quarantine 14 days is the least risk opportunity, and so when I'm talking about it, I'm really talking about it in terms of our families. I'm talking about it in terms of the individuals that we support. So, and I'm talking about it in terms of our essential workforce. So our essential workforce, we're testing, and they're working, and they're masking, and they're screening, and we've been doing that, and we've been doing that really successfully for a long time since this pandemic started. So this is really more for the rest of the world who just really struggle with following that quarantine guidance. But it's not that it's okay to be out in the community with your mask off, going to choir practice. I'm just saying those are high-risk activities. So if you're a high-risk person, which if you're a contact, you're a high-risk person, don't do high-risk activities. And the same for the individuals that we support. If they're high-risk people, if they are not going to be mask compliant, if they're not going to wash their hands, then this new quarantine guidelines is probably not for them. And we know that individuals with developmental disabilities are at really high risk of having very poor outcomes if they contract COVID. So to me, all of that says that the 14 days really is still the best practice that we should be following for quarantine when that's the practice we've been previously using. Also, as an essential workforce, continue using the practices you've been using as an essential workforce. So I don't know if there's going to be questions about that. If there are, I'll take a look at them. I think there'll be some more information come out on this from the state. I know there's been lots of articles. Headlines are a little tricky because they'll say things like quarantine's now 10 days. That's really not what that messaging is about. So just wanted to spend a little time talking about that a little bit. The other thing I wanted to talk about, and then we'll get to vaccination, a couple other things. The testing update. We're getting a lot of questions from community providers about access. I think some have been able to access rapid testing, some have not. We're trying to really understand what it means if you're a provider that wants to access that rapid testing, the antigen testing. I did just hear on a call, though, your ability to obtain those tests is going to be pretty limited. Those are still not available on the open market at this time. So how do states get antigen tests, rapid tests? There are, if you're a long-term care facility, and some of you may be able to access through that, I'm not sure, but if you're classified as a long-term care facility, they will directly ship you those tests if you meet all the criteria. That includes being a CLIA waivered lab. And so Kim Stock and I have been learning about being a CLIA waivered lab. We'd always kind of approached it from the medical lab side of things, but we're learning that the medical lab side of things really isn't necessary for the CLIA waiver for these kind of tests. So we'll continue to look into that. Some of you may have already had success with that, but understanding that. But if you're trying to, think you're going to be able to order a bunch of rapid tests, whether those be Abbott ID Now, Veritor, Binax Now, those tests really are not available on the open market to order at this time. So the way the state gets them is they ship directly from the manufacturers, Abbott, whatever pharmaceutical company we get them from, to the state, and then the state distributes them primarily long-term care. And there's a plan from the federal government on how we distribute those: higher ed institutions, elementary and secondary education institutions, long-term care facilities, congregate facilities. And so that is really what has been being worked on at this time. So we will continue to look into that. And if some of you have been able to access that, that's great. But overall, I can't write a paper that says do X, Y, and Z, and then you'll be able to start using Binax Now testing. But we're working on that. So I wanted to share that. I know that we get a lot of questions from the providers on that front. The budget update. So federal effort around extending CARES Act, getting the states more money is gaining momentum. All of the national partners seem to agree with that and think that there's a really good shot that before December 30th that there will be some sort of extended stimulus package. It also looks that will include some money that will be directly shipped to states and local governments, so that's really good information. Remember, we're using that money to pay for PPE. We're using that money to pay for testing, and if there's anything that comes up on the vaccination side, we would be able to use that money for the vaccination side. We also use that money for direct grants to our providers for their invoices for their cost or business interruption that we have done. So very valuable money for the Department of Mental Health and our providers, and we're happy to see that there is some true movement in that direction at the federal level. Remember, the federal budget right now is operating under a continuous resolution. So that's just the regular operating budget for the federal government, not the stimulus funding. That has to be either a federal budget has to be adopted by December 11th or another continuing resolution has to be put into place by December 11th. So between now and December 11th is when I would expect to see most of that action around either a stimulus bill and the federal budget or both together. So but really feeling a little bit more optimistic about that now than I was, say, before the election. CARES Act update. So we are still, as a state, using our CARES Act funding, and as the Department of Mental Health, we're still using our CARES Act funding. That is still used to cover provider testing in congregate care settings. That's also still, we're able to purchase PPE, and if you need PPE, we're able to get you access to some of that also. Also, we did find out on Monday or Tuesday, we call them COVID days now. I think you all can attest to the fact that they do seem to run together. We did get confirmation from the governor's office that we have an additional $2.4 million to spend in for our day habit employment providers, and we can do that as business interruption or invoices directly for PPE overtime, the same kind of cost that we had on the residential side. I know that provider relations in the regional office, Angie, Christy, all of our folks in central office are working really hard to get that out the door, so that folks can apply for it and we can get those checks into people's hands. We'd like to have information from providers by December 15th so that we can get everything processed. before the December 30 deadline. So please, if you've not heard about that, be on the lookout for that. If you've got questions about that and you think you're eligible, reach out to your provider relations staff at your regional offices. Next, we want to talk, okay, let's go to, well, I want to do one more thing and then we'll go to vaccinations, and then Kim and I will do a little tag team on vaccinations. Cool thing going on, we've talked a little bit about staffing challenges. I think we're at the point now, and it's not getting better across the entire healthcare spectrum, and we're in that healthcare spectrum. There will be a virtual job fair December 22nd. This will be a healthcare-specific job fair focusing on entry-level clinical and non-clinical positions. Heike has pulled up our ding that we sent out. This is a really great opportunity for our providers to register for this job fair. One of the challenges we have is when I go to meetings with people like from the Department of Economic Development or the Department of Labor and Industrial Relations, or even the governor's office, and I say that we don't have enough employees. We don't have enough data that shows that we don't have enough employees. Registering for these kind of opportunities really improves our ability to show that we need help in the staffing front. So please consider registering. It's all virtual. There's an employee registration form, and that needs to be completed before December 16th. Okay. Now I'm going to go on to vaccinations, and we actually had a lot of questions on vaccinations. So I'm going to actually, one of the questions that we had on vaccinations, I'm going to try to find it. When COVID, oh wait, hold on. Basically they want to know what's the timeline on when we're going to, do we have a timeline for when we expect vaccines to be available? I just got this. So Pfizer, who has got one of the vaccinations, it's the one that both vaccinations that we're going to get in Missouri right now will require 2 doses. So 1 dose, 21 days later, a second dose. Pfizer, it's supposed to be, their emergency use authorization meeting at the FDA level is supposed to be on December 10th. So if that is approved on December 10th, then they have to go through another process. That should be done by December 14th. 15th vaccinations should be pre-positioned before that period of time. And in that first round of vaccinations, Missouri's estimating to get 52,000 doses. Those will probably primarily go to hospitals, to direct care workers, direct care, essential health workers, patient-facing health workers in hospitals first. So we expect that vaccine will be in place by December 14th, December 15th. By December 21st, we expect to be getting access to the Moderna vaccine and the Pfizer vaccine. And we're estimating that we'll get about 105,000 doses of the Moderna vaccine and 63,000 doses of the Pfizer vaccine. The difference between the Moderna and the Pfizer is the storage. The Moderna vaccine can be stored in a refrigerator. It does not require the ultra cold storage. So the Moderna EUA meeting, that's the emergency use authorization meeting, is not officially scheduled, but we hear it's going to be and it may have gotten officially scheduled since I've seen this, but it should be that next week. So not the week of December 10th, but the week after that. As soon as all of those, and then we'll get another round of doses scheduled on December 28th, and at that point in time, we're estimating to get about 110,000 doses from Pfizer and Moderna 56,000 doses. So we should be in the state of Missouri, healthcare workers, essential healthcare workers should start getting shots in the arm, we think, before December 21st. Again, most of those will be hospitals. I think that anybody who has worked on getting in their vaccination pipeline, working either with their local public health agencies or with their local pharmacies, I think that those vaccinations should start to become available for our folks, I would say even possibly before the first of the year. Remember, it's our employees first and our residents second. I know that for us in our facilities, we've gotten confirmation from CVS that we're in the pipeline to get it, and so we send back how many we think we're going to need, and then they will put in that order for us, and when they get theirs, they'll let us know. Also, I will tell you that so remember, an emergency use authorization vaccine cannot be mandated. We cannot mandate these employees get it. We cannot mandate that residents get it. What I can tell you, though, is through surveying our staff, we're seeing that about 60% of our staff are ready to get the vaccination. So we continue to educate about the vaccination, and I think you'll see a lot of big, heavy-hitting education on the vaccination just over the course of the next 2 weeks, but wanted to share that with you, okay? Now I'm going to go to the questions specifically. ACIP, because I think I covered everything there. And then I already did that. Okay, sorry. If you guys could see my notes, they're kind of in a circle. Okay, so to the questions. The ACE, because that's how I get it, the ACIP recommended today that residents of long-term care facilities be included in the Phase 1A category along with staff so that they can be vaccinated at the same time. Will this change where ISL clients fall in the vaccination process? So both staff and residents are in that 1A category now. Before we had staff in the 1A category, residents at the top of the 1B category. So the answer is yes. But if you actually looked at the state's hierarchy, it really doesn't change anything there. It moves them up, but there wasn't anybody between the residents and the staff that they got bumped ahead in Missouri's plan anyway. So that kind of, I think, helps explain that. So we went from the top, residents went from the top line in the 1B category to the bottom line in the 1A category, and they didn't jump over anybody. But it's good recommendation by ACIP that was included. We appreciate that. In your prior webinar, you said nurses who are currently completing visits through telehealth calls would not be included in the Phase 1A category. Does this apply to community RNs or just regional QERNs? If the community RN as well, what category would community RNs fall to? Again, it's going to depend on if the RN services provided are considered patient-facing direct care. That would be category 1A. Now, as an RN, you're going to get access to this vaccination not through your primary care provider. You're going to get it through your employer. So if you've worked with your employer and your employer has gotten you into the 1A category to get vaccinated because they have a relationship, that's going to be your best way to get this vaccination at this point in the 1A category. You're not going to just be able to show up at Walgreens or CVS and say, I'm 1A, here's my nurse license. At this point in time, that's not how this is going to work. So you need to be working with your employer to get categorized into that 1A category. I answered the question, do we have a timeline for when we expect vaccines to be available? Definitely will become available in the state. We definitely believe during the month of December, small dosage, limited allocations, hopefully by January and maybe even the end of December, it will start getting to our locations. I'm going to let Kim talk about the process to sign up for the vaccine, but I am going to move on. When COVID vaccines are made available to those in long-term care facilities, including our DD folks and waivered residential supports, will those that are medically fragile and have self-directed supports PA through a DMH DD waiver be eligible also? So again, how we're accessing the vaccine for all of these different folks is through providers. And right now, we don't have any reason to believe that primary care doctors, which is probably more likely where self-directed support, individual and self-directed supports receiving personal assistance, would be getting the vaccine is probably through a primary care provider. So the really upfront focus is on those very large congregate care facilities and the direct patient care workers in those locations. So you're still going to be high on that priority list and will probably definitely come in the 1B category when we're trying to really get vaccine out more directly to people. But that 1A area really is more heavily focused on employers securing vaccines for their staff, their residents that meet those qualifications. Okay, here we go. I have an individual that receives SDSPA through the comp waiver at her home because her mother prefers this over group home or ISL supports. The individual is medically fragile. If she qualified, were her caregivers qualified for the first round? What about her designated rep, AKA her mother? And again, just that question also falls under exactly what I just said. Really, access to 1A round of vaccinations is going to be through an employer, and then in the 1B area, it will be more they will be more readily available at that local level. I believe, at this point in time. Now, when they actually roll in here and we're putting shots in the arm, you know, you got to get scrappy. I mean, we got scrappy on testing. We got to get scrappy on vaccinations, too. And as I learn more, and we're scrappy here on your behalf. So as we learn more, we will share that. We can point this out. But right now, remember, limited doses, lots of people in that 1A category. So, okay, thank you for pulling up the vaccination information page. I still really enjoy this page a lot. So if you haven't had a chance to browse through it, please do so. Also, okay, I'm looking through the questions right now. Okay. Oh, yeah, okay. So Mary Sullivan, Thomas, how do I obtain the PPE? I need N95s and gloves, please. Yes. So again, still work through your regional office folks, and Kim may be able to answer that better on how to get to the PPE, because that's been a while. I will tell you, though, N95s and gloves continue to be our struggle, but yeah, there is a way that we can work through that at the local level, too. How do we get included in the 1A category? I talked about that quite a bit, so I'm going to move on from that question. Is the job fair something that TCM agencies should participate in? I mean, I don't think there's any reason not to participate in it. I mean, and this is what I love this question, actually, because when we were talking through, is that too many ways to put information out there? And I just said, I can tell you that my facilities and my providers try every angle they can try to get employees. I just don't think a lot of people understand how desperate we are to get employees. So, try it. That's all I can say. Try it. Am I understanding that will be mandatory for employees to have the vaccine for COVID-19? Absolutely not. And I've said this multiple times, and I will say it again. You cannot, and that's a can and a not, you cannot mandate an emergency use authorization vaccine. The COVID-19 vaccine is an emergency use authorization vaccine. It is not mandated for employees or for residents. We are asking all of our employees, because we have to be, and I'll tell you why we're asking our employees if they want to get the vaccine or not, because then we have to turn around and tell the pharmacies that we're partnering with how many vaccines to order on our behalf. And so I don't want to tell them to order 450 vaccines, but I'm only going to have 150 employees show up to get vaccinated. So that's why we ask that question, but we ask it in a way, there's no HIPAA issues or anything like that. It's a very clear survey. Would you get the vaccine or not? Then we can give the pharmacy our order. Please know that we know people are going to change their mind. They're going to say, I decided I don't want it, or I've decided I do want it, and we continue to do our best. But again, we're trying to plan for that very limited supply. So the vaccine, no. And again, the vaccines are not mandatory for DMH employees, employers. They cannot be mandatory. It's a big question, I know that. Who would be submitting the list of 1A employees too? So that's whenever you go in to sign up. And Kim's going to talk about this a little bit. But when you go in to sign up to get access to the vaccine, you're either going to be submitting the number of vaccines you need to a local public health agency, a pharmacy, or on behalf of yourself if you choose to do it on your own. And that's all the questions I've got. So I'm going to turn it over to Kim Stott now, and she's going to talk about, again, all those ways to get access to the vaccine.
Thanks, Val. Good morning, everyone. So our frontline efforts right now, as Val mentioned, are focusing on supporting all of you out there, our HCBS community providers who meet that criteria for the Phase 1A prioritization. What we've done this week is you should be, if you've not already received through PR, through provider relations at your local regional office, an email to your agency contact. So if it's not crossed your desk, check with your other administrative team members. That letter, email communication, is providing you with some current links, such as the Stronger Together website that Heike has posted here, which is a good resource where you can stay up to date and current. Also reminds everyone to stay registered for our email blasts, our notifications, because as we get information, we will be making sure that we disseminate and communicate that out to all of you. And then we also included in that notification communication effort information in regards to a survey that we developed. It's a quick ask. please, when you receive the communication from us, from Provider Relations, take a few minutes, compile your agency information, just as Val mentioned, on who within your agency direct care worker staff that meets that phase 1 criteria is interested in volunteering and receiving the COVID-19 vaccine. When you compile that information, if you could take a few minutes and send us back what we're asking in the survey. Again, we don't want any identifiable information. We're just needing estimated counts. And then what counties are you currently providing services to individuals in? The reason that we're asking for this information is we're going to take the same approach that we've done with testing, and that we're going to compile that, and then we're going to be communicating and reaching back out to your contact that you've listed in that survey directly. And as we get information about what vaccinators are in those applicable counties where you're providing services, we will do our best efforts, as we did with testing, to try to connect you, get you the contact information, and kind of support you to walk through that process with either your local public health agencies or some of those other approved vaccinators across the state, which, by the way, that's a process that's still occurring in partnership with DHSS, and that could be some of your larger chain pharmacies. Once we have that established and we're communicating that with you, then it's going to be up to you to work directly with that vaccinator contact to make sure, as Val mentioned, that when vaccine becomes available, that they understand that you meet that criteria and that you can support your agency employees to get vaccinated. So again, that's the efforts that we're doing frontline first. So please be looking for that notification, that communication that should have came out this week. Also, just so you're aware, we did go ahead as a courtesy and have our regional office nurses send that same communication to the RNs who provide oversight for your agency as an FYI. And again, that's because the nurses can stay up to date and current on the information through these resource links that we provided in the communication. One other thing I want to note and point out is in that communication, we also have set up a DD mail, designated mail site. So if you have questions, and I know everyone probably has a lot of questions right now, please send those in to us through that designated mailbox. What we will do then is compile those, do our best efforts to get the information and communicate that back out. We're working on the initial draft of an FAQ document around the vaccination efforts and hope to have that posted early next week. And that will continue to be updated again as we get new information and things evolve in this particular process. So again, please use that communication effort through that designated mailbox. That's where you're going to get the best response that we can provide. And it helps us to know who we need to follow up with and specifically as well. So I think that's kind of a high-level overview for now on those efforts, so that communication's gone out. Anything else, Val, that you can think that you'd like for me to cover?
No, I mean, that's perfect, Kim. I did want to address this last question in the chat because I think it's a good question. Because I talked about how we did ask the question in the survey if our employees have serious medical conditions, and some employees may not want to divulge this information. The advantage to divulging the information of it, do you have a serious medical condition, and that would be like if you're going through chemo treatment or something like that, is that those folks can get access to vaccines. Oh, wait, no, those folks can't get it all. If you've got diabetes or something like that. I'm sorry. I don't mean to confuse anybody. So let's go back to rewind. Okay. The survey you've asked us to complete, ask if our employees have serious medical conditions. Employees may not want to divulge this information. The advantage to divulging this information, again, we're not asking for names or anything, is that the pharmacy may call, if you're working with a pharmacy or a local public health agency, or if you're trying to order vaccinations, the first round that you may get access to order may only be for your employees who have serious medical conditions. So let's say you've got 450 employees. 150 employees have said yes, they're interested in getting the vaccination, and 50 of those employees have a serious medical condition. It just helps us know how much vaccine to order. And that's why we ask that question, okay? So and if an employee does not want to divulge that information, that's fine. They don't have to. It's just part of how we can put in how much vaccine we get to order, because, again, we think this is how much we're getting, but we're not sure. So that's why it's limited supply, and we want to make sure we get the most vulnerable essential workers vaccinated first. So anything else?
Yeah, so Val mentioned earlier that, the department has surveyed DMH employees. That survey did not have asked the team members for any identifiable information. And so they completed that out and submitted it to their local facilities or regional offices. And we just tabulated the information. So again, if you want to take that approach as an agency, that seems to work well. Again, it's just trying to figure out frontline initially the number of vaccines that you might need up front and how to prioritize those. And then I think if it's all right, I'll move on to one other item that I had today, which is still COVID related. We've had conversations in the past about monitoring individuals ongoing and monitoring their pulse ox levels. And so we did a frontline effort. We're working on an Observe Decide Act document on the importance of that particular monitoring aspect. And when we are sending out the communication this week and next to the nurses who provide RN oversight, we're also asking them to complete a brief survey, and we're providing them with a link on your agency's current policies around that particular aspect of monitoring, and if you currently have access to pulse ox capabilities. So I think that, again, if the nurses could take time to briefly fill out that survey, that would be wonderful, because then what we can do is follow up with you if we find that, you need some additional support in that particular important area. And I think that's all that I had at this time, so I believe I'm going to turn it over to Leslie now.
Thanks, Kim. I just have a quick update. The Factor C reduction waiver amendments effective January 27, 2021 for comprehensive community support and the partnership waivers are all under review with CMS, and we are in informal request for additional information status. Also, the COMP and CSW renewals, as well as the partnership and MOKIT amendments to align with those renewals, will be published and posted soon for formal public comment, so please watch for those. And that's all the updates I have. Thank you.
Thank you, Leslie. There's a couple of questions in the chat, so I was going to try to talk to those. Is there a link where we can find in writing that the emergency use vaccines cannot be mandated? I just did a quick Google search. I actually got that out of the Vaccination Task Force that we're a part of here, so I didn't see it in writing, but when the Department of Health and Senior Services tells me I can't mandate a vaccine, as an employer I can't mandate a vaccine, as a service provider I'm not going to try to mandate a vaccine. So that's what I know. I don't have a magic link with a big red button that says, no, you can't do this. But I think it's relatively common knowledge, I guess, if you live in a vaccine world. Wasn't to me until 3 weeks ago. The next question that was in there is, does the survey state the definition of serious medical condition for purposes of surveying staff? No, it does not. It's very brief, the survey is. So, but I know I don't have a serious medical condition. I guess if you're on the border and you say, yes, you do have a serious medical condition, and then you present to get your vaccination at a local public health agency or something, and they ask you what your serious medical condition is, they don't think it's serious enough, they'll make that determination at that level. So the survey is intentionally easy because we just really are trying to get an idea of numbers. We know it's not going to be perfect. We know people that say yes now will say no later. We know people that say no now will say yes later and want to go get vaccinated. Again, it's for planning purposes, and that's why we're asking those questions.
Val, if I could add.
Yeah, go ahead.
Sorry. And just as a reminder, everyone, CDC has posted guidance on individuals that are considered at an increased risk for severe illness in relation to COVID-19. And so that information is posted out on the CDC site.
There's another question. Where are DMH providers getting the survey? I think that went out as part of the packet, right, Kim?
Yeah, you should, as an agency, please be looking and talking to your administrative team, because PR sent that out to whoever they have listed as their communication contact for your agency. And again, we also sent it out as a courtesy to the RNs who provide oversight.
Right. So just be looking. And then, hold on, because they're coming in now. We got questions coming in now. Is there a particular consent form we should have employees and guardians complete? So on the employee side, unless you're actually giving the vaccination, you won't need a consent form. They will sign that if they're going to the local public health agencies or to the pharmacy, okay? If you're getting vaccinations, your staff are giving that vaccination, then you will need to be getting that consent form. If you're going to be helping individuals you support get the vaccination, look at your flu consent form. I think that's what Kim really has done, is looked at our flu consent form and just update it for COVID-19, right?
Yes.
Yes. So it's not, that'll do it. Are we completing info for just DSPs or other staff as well? So again, group 1A are your patient-centered healthcare workers. Now, I know a lot of us in the provider world right now are using everybody in that role. So I know, for example, my entire HR team, who typically does not go out and do work in the direct support role or in supporting employees, is doing our testing right now. So, you know, it just depends. They need to be in that patient-centered health role in the 1A category, okay? And, yeah, that answers that. Okay. And assume but want to confirm that vaccinators will be providing consent forms as they do for flu. Right. I really do. Now, I think on the resident side, it will be helpful if you go ahead and get that done. But if you're working directly with a pharmacy, they may already have the consent form they want you to use. But, yes, we assume that also at this point in time. Okay, I think I got that question. Okay, I think that's all. We did have some additional questions. I don't know if I said this already, COVID day brain. But there were some additional questions about service provision that were put in the Q&A. We will address those in the Q&A later because we recognize we've already been on this call for 45 minutes. So those answers will come out when the answers to the Q&A come out. I know there's lots of questions about vaccine, and please know we're doing testing and funding, and I do hope you find these calls helpful in at least knowing what we know, and that's really where we're at right now. Thank you for all you do. Stay safe. Keep your staff safe. Keep our residents as safe as we can. I know everybody is tired, and you know, when you see those deaths roll across when you see those deaths come in, you're caught somewhere between frustrated and helpless, because that's how I feel. And it's hard not to just become numb to it, but you can't and you won't. And so keep up the good work. Thank you all for what you're doing. We'll talk to you again in a couple weeks, and it'll be a different world in a couple weeks. We know that for sure. Thanks. Bye.